I will be demonstrating the IV insertion skill. So I would start by checking my chart and my order, and I would verify that my patient did not have allergies specifically to iodine. Then I would enter the room, wash my hands, and introduce myself. Hello, my name is Bree. I'm your student nurse. Provide for privacy. Can you give me your name and date of birth, please? And she tells me that her name is Dottie Cheetah and her date of birth is 01/01 of 11. Excellent. Well, Dottie, I am here to insert an IV for you. Your doctor ordered that we get an IV started so we can run some fluids for you. So all it's going to be is that we take a needle, put it in your vein, and then we'll retract the needle, leaving just a small tube in your arm, which is the IV catheter, and that gives us access to administer fluids and medications as needed. Do you have any questions for me about that? And she says no. And are you okay with doing that right now? And she says yes, that's fine. So Dottie, I'm just going to go ahead and get set up here so that we are all prepared to put the IV in. I'm going to take this chuck and put it under the arm. I've got all my supplies that I gathered previously. Okay. Now that we are set up, I've got Dottie's arm in a dependent position, and I'm just going to take a look at the vein and see what we have to work with. And as I'm looking for the right vein, or the best vein, I'm looking for a straight vein. I want to be distal from the joints if possible. I can kind of touch and it would be bouncing back a little bit. If it's a vein, I'm making sure that I do still have a radial pulse, so I'm not restricting arterial flow. If I was having trouble finding the vein, I could tap. I could ask Dottie to clench her fist and release, or I could also put a hot compress on that vein. But I found one now. I'm going to release the tourniquet for now. Alright, and then I'm going to just get set up here. I'm going to take my flush and connect it to my lock. I'm going to fill it and prime my flush so there's no air in there. And I would loosen my cap so that it was easier for me to put onto the IV once I have that started. And I'll just leave that right here. I'll also take my IV and just loosen the cap on that. Okay. I'm going to wash my hands again and put on my gloves. I'm going to get an alcohol swab, and we're going to swab that site where we're going to do the IV, starting in the middle, doing a circular motion outward for as long as facility policy requires. And I'm going to let that site dry. I'm going to reapply the tourniquet. Alright, we're all set here. I'm going to hold below my insertion point. I'm going to hold my IV bevel up, and I'm going to insert at a 15 to 30 degree angle until I see the flash. As soon as I see the flash, I can go nearly parallel to the patient's skin, another ½ centimeter, and then I'm just going to go ahead and advance my catheter to the point of insertion. Once it's to that point, I can retract the needle. I would put on the safety at this time. And connect my saline lock. And secure. At this point I can let go since I do have it secured. I can flush to make sure that it's viable. I push a few ml. I can also watch to make sure that there's no sign of infiltration, and I would ask Dottie if she was feeling any pain. At that point I can clamp and remove. I'll go ahead and peel my cover for this, and apply it. I don't want to put it over the white, but I do want to put it over the pink, leaving the window so that I can do assessments in the future of the IV site. I would take this here and I would initial, date, and label the gauge. In this case it is a 20 gauge IV. And I'd put it again to the side so you could still actually see the insertion site for assessments. It's secured there. I'd take one more piece of tape. I can deglove and wash at this point. I lost my end. And just set this up a little bit better so it's not wiggling around as much on Dottie's arm. In real life, I would not put it over the patient's wristband. It'd be further up their arm. Okay. Now I can clean up all my supplies. I would dispose of everything. I'd make sure my sharps bin in the sharps bin. I would make sure that Dottie was safe and comfortable, that she had her call light, side rails up, bed at its lowest position again. Upon leaving the room, I would document the IV insertion, the date, the site, the gauge, how the patient tolerated the insertion, if I had multiple attempts. I would flush that IV according to facility policy, whatever frequency the facility required, and I would have washed my hands upon leaving the room.